When I was 7 years old, like around that age, I kind of realized that I wasn't able to keep up with the other kids.
I thought, oh my God, what am I going to do? I mean, I can take care of a baby that's had a cold, but I don't know what to do.
I couldn't always do sports, and I've always wanted to, and I'd always get short of breath and just feel tired all the time and have as much energy as other kids.
I guess my biggest challenge has been facing the future. Is Jalen going to be healthy in 10 years? Is he going to have had another surgery?
When I turned 10, or around that age, I really understood how severe my condition was.
I'm just the type of person, I want to know it all. I want to know what I'm up against.
I was diagnosed with cardiomyopathy. It's a disease in the heart.
She was healthy when she was born. We had no clue. And then she had gotten a stomach virus. We went in through the emergency room, and when a pediatrician that's there on call says, I'm really quite worried about this, but we're going to run more tests. And here's my baby crying, they're putting IVs in her, and I'm just falling apart trying to keep it together on the outside.
Just kind of overwhelmed with where we were. Things were moving kind of fast, you know, just trying to understand basically what was happening.
She didn't look like she had something wrong with her, only we knew, and she pretty much was healthy for a very long time.
Well, me and my sister have had echoes done and blood work, and they've seen that it runs in the genes in my family.
I was diagnosed with cardiomyopathy about 2.5 years ago. I was in high school on the drill team.
We had an echocardiogram, and she has the same thing. It's much milder.
I didn't really expect it, and she's always had it her life, and I always thought she was special.
I honestly didn't think Pam would be diagnosed with the same condition that I had. I never thought about it.
I get stressed a lot just because I'm like, I was fine before, you know. I went through, 16 years not having to take any medication, no problems at all. And, you have to start taking it because apparently you have cardiomyopathy.
I was kind of scared and worried that she'd have to go through all the things I did.
Christopher was diagnosed with cardiomyopathy when we went to National Institute of Health.
I have learned to accept my heart condition. It took a while to actually accept it, because when you're younger, you want to enjoy being with your friends and doing the things that they do. But at the same time, you got to watch out for yourself.
I understand that it's difficult for him because he's always been healthy, so he doesn't know why the doctors or myself would tell him to slow down.
I would just run around and I wouldn't really be affected. I wouldn't really feel it.
Very different in terms of their symptoms, Chris and Justin.
I was diagnosed at birth with cardiomyopathy. I was symptomatic. I became short of breath easily. When I was little, it really didn't really prevent me from doing strenuous activities. I still rode my bike around because I really didn't know what I was doing.
As he got a little bit bigger and taller, he had difficulty breathing, and we realized that it was affecting him a lot more.
I definitely was restricted from physical activities, but it wasn't as if I was being told I couldn't. It's more that my body, I knew, couldn't handle the activities.
I have trouble running, whereas he had trouble walking.
There'd be times when I'd try to push myself, I'd try to jump up a flight of stairs, and then I'd be completely breathless.
Jalen was diagnosed when he was 2 with restrictive cardiomyopathy. It's a rare, one of the rarest ones. It's kind of disbelief, I guess. They gave, some reading material about it, and we read about it, and it just was unbelievable. He was still, I thought, pretty active, you know, like, you know, in watching a cartoon or something, he'd get up and dance, and man, you know, he could just dance, and I just couldn't believe that there was anything wrong with him.
In the United States each year, we have on the order of about 5,000 cases or so of children born with cardiomyopathy or who in the early years of childhood develop cardiomyopathy due to different conditions.
Cardiomyopathy breaks down into multiple parts of the word. Cardio is heart, myo is muscle, apathy is disease. So by definition, these are heart muscle diseases.
There are many types of cardiomyopathies: dilated, hypertrophes, restrictive. Within all of those, there are some that can be genetic and some that are not genetic.
It becomes so important to try to understand really what type of cardiomyopathy the child has.
The most common flavor is what we call a dilated cardiomyopathy.
And in dilated cardiomyopathy, the heart, instead of being normal in size, is a little bit enlarged. Instead of it having a nice, normal, forceful squeeze to pump blood out to the body, it's weakened. If it's weak enough, the child has congestive heart failure.
I had the privilege, really, because this is a terrific family, of first seeing Linda when she was an infant. She was 6 or 7 months of age when I first met her, and she was extraordinarily sick. She had a gigantic heart that really didn't work at all. She improved to the point of being asymptomatic. Even though her echocardiograms continued to show a cardiomyopathy, she looked quite well, started growing, and started acting like a regular child of a year of age.
Linda was healthy. She wasn't a sickly kid, other than taking her meds every day.
I still got to do a lot of normal things, but mainly I couldn't do the most active things that normal kids could do.
And life was as it was in the beginning, just doing that, taking her medicines, going to see the doctors, you know, every 3 months, then it got to be every 6 months, and then it got to be a checkup once a year. And this went on for, gosh, up until the time when she was about 14 years old.
She started becoming increasingly symptomatic, became hospitalized several times for heart failure. So we went ahead, relisted her for transplantation. She underwent transplantation about 2 years ago and has done remarkably well and is a regular teenager.
I feel great. Like at first, I couldn't realize the difference, but now that a year has gone by, I feel so much better. I have so much energy. I just feel more of life.
We went in to see the doctor one day, and it was a scheduled visit for Linda for a checkup. And Sarah, who's the coordinator, she said, "Why don't you bring Pamela in? Dr. Tobin has been doing some sibling screening, and let's just get her screened."
And if Pamela hadn't been brought in simply to get screened because of her sister, she would still not be diagnosed because she really wouldn't have presented with any significant enough symptoms to require therapy or require anybody to think she had a heart muscle problem.
The only thing that came to mind was that, oh gosh, might have to have a heart surgery. When they let us know that, you know, her condition is basically a flu and yours is a, you know, mild cough, then I kind of backed down. I was like, okay, I think I can do this.
Hypertrophic cardiomyopathy is the second most common form of cardiomyopathy. In hypertrophic cardiomyopathy, what you see is that the muscle of the heart starts to get very thick.
It's smaller, if you will, but very thick-walled, and so it squeezes well, but it relaxes very poorly.
Something in the body or something in the genes is telling those muscles to abnormally thicken. A normal muscle might thicken because you're exercising, because you have a high blood pressure, but this muscle thickens without a good cause.
That's the most common cause of sudden cardiac death in young, healthy, athletic kids, and so when you hear about death in a high school football player, that's usually hypertrophic cardiomyopathy.
For instance, Justin and Chris have the same genetic defect in their family, and it's very interesting that one of them has had a much more severe form of the disease by teenage years than the other.
Hypertrophic cardiomyopathy has restricted me only by my endurance. I guess you can say that. I don't feel the symptoms of chest pains or anything else. The only thing that I feel is shortness of breath.
Since birth, I was symptomatic. I still ran around like any normal kid.
After a long period of time of having a very thick heart, that heart becomes tired. It becomes more difficult for that heart to pump the blood out, and that was what was happening with Justin.
We worked with his doctors, and at that point they thought that maybe transplant.
Over the years, my condition just worsened, and then I got the transplant. I felt better than I've ever felt in my entire life, and I was pretty much ready to do anything.
A very small percentage of patients with hypertrophic cardiomyopathy actually end up needing a transplant. And I think it's important for people to know that the treatment is there if you need it, but in most cases, medical therapy, pacemaker therapy, surgical therapy is effective for returning that child to a normal lifestyle.
Restrictive cardiomyopathy is the least common form of cardiomyopathy, but it's amongst the most severe. While the ventricles, the pumping chambers, squeeze beautifully and are normal size, they relax extremely poorly. They're stiff. They do that. And so because of that, flow has difficulty going forward. They stay in the atria. The pressure in the atria increase. The atria are like thin-walled balloons to some extent, and so they balloon out. And so you get these gigantic balloons at the top, and at the bottom, normal-sized ventricles. And so that's restrictive cardiomyopathy. This particular case, young Mr. Jalen, is typical for restrictive cardiomyopathy in childhood. So when we first saw Jalen and that diagnosis was made elsewhere, we restudied him, confirmed the diagnosis, and told the family in pretty much no uncertain terms that the only therapy for this young man was going to be transplantation.
They gave him 2 years to the diagnosis, so it was quite a shock.
So he was evaluated, put on the transplant waiting list, and fortunately within about 3 months of us meeting him, he was listed and transplanted. Arrhythmogenic right ventricular dysplasia or cardiomyopathy. This is an unusual form of disease in that it affects the right ventricle, the other ventricle if you will. And that ventricle gets dilated, it gets very thin-walled, and when you look under the microscope at this heart, it has, instead of heart muscle cells, it is infiltrated with fat and with scar. And then the newest kid on the block, if you will, which is actually a kid disease more commonly than an adult disease, left ventricular non-compaction, which is a funny looking disease in that the left ventricle looks a little bit like a right ventricle. It makes the heart squeeze in a funny way and looks a little funny on an echocardiogram, an ultrasound of the heart. And so that's a new one, but it's an unusual one, and there's more to learn.
Right now, with ultrasound exams of the heart, echocardiograms, or MRI exams of the heart, magnetic resonance imaging, we're actually able to non-invasively and in very short order be able to diagnose this with much less expense.
And the two most common ways to be diagnosed are from an EKG, which is a recording of the heart rhythm and the heart, actually not only just the rhythm, but the electrical voltage generated by the heart, and the echocardiogram, which is an ultrasound of the heart, which actually shows us the structure of the heart.
And this is the left side of the heart here, and this is the right side of the heart here.
It's pretty scary, you know, not knowing for sure or not if he was born with it or if he just acquired it.
By being able to really understand what the cause is, we'll be able to treat the children most effectively based on that cause.
So when you consider cardiomyopathies, even though there are many different types, each of those categories come into really two different flavors. Those that are genetically determined and those that are due to something else. Sometimes we know that etiology, sometimes we don't know the etiology and call it idiopathic.
Fewer than 1/3 of all the children in the United States with cardiomyopathy actually have a known cause.
The most common causes would be an acquired form of disease, usually viral induced. Particularly the muscular dystrophies tend to essentially all be associated with heart disease and dilated cardiomyopathy. Then there's the genetic causes.
Cardiomyopathy can be associated with other problems in the body. The heart forms by the time the fetus is 3 months old. So at that time the heart is forming, other things are forming as well. So we do know that you can have problems such as Noonan syndrome, such as metabolic diseases that might affect other muscles, the muscles in the arms and the legs, things that might affect the way food is metabolized in the liver, so you can have a large liver, so that in infants with hypertrophic cardiomyopathy, we're often looking for other problems.
Sometimes we realize that what we might have thought originally was an isolated cardiomyopathy in the child may actually start forming a pattern. We may see other people in the family that are affected, brothers, sisters, parents, aunts, uncles, grandparents, and once we start seeing that pattern, it may be more obvious to us that there is something genetic or familial that's going on in the family.
Cardiomyopathy has run through my family. It started with my grandmother.
But when we went to National Institute of Health, they did the gene study and found that, of course, he carried it. My brother has it. HCM was from my mother's side. They traced it back to her father. I was diagnosed with HCM when I was officially diagnosed when I was 13 years old.
I believe in my personal case, since I don't have any symptoms aside from being short of breath, that if I was not diagnosed as a child, I would have probably gone into competitive sports and something bad could have happened.
At this point, when we look at all types of pediatric cardiomyopathy, approximately 30% are known to be genetic. However, I guess that's probably an underestimate because our genetic tools for making the diagnosis have rapidly improved very recently, and so it's only now for children that are being evaluated that I think we're getting a better appreciation of those that are genetic.
The Pediatric Cardiomyopathy Registry, with the support of the Children's Cardiomyopathy Foundation and the National Institutes of Health, has really been able to tell doctors all over the world when a newly diagnosed child presents, these are the tests that are going to be the most helpful at figuring out why this child's heart is not healthy in the least invasive way, in the quickest way. Every child, even though they all carry the label as having cardiomyopathy, may have a very different set of outcomes, set of restrictions, set of treatment plans.
It's really very important for a child with cardiomyopathy to be treated by a team that's familiar with cardiomyopathy, how it affects the child, how it affects their activity level, what the future will bring for them, and also is good at working with families.
The more there's a great working relationship between the cardiomyopathy team and the family, the better the quality of life, the more there's a real reason to believe that you can live with and beyond cardiomyopathy in your family, and that's critical.
The treatment plan may include medications, it may include surgery, it could include placement of a pacemaker, and in some cases it includes even more serious interventions, such as use of a device to help the heart while the patient is sick, or even taking the heart out and doing a heart transplant.
We can, what I would call, individualize or personalize the treatment based on the specific gene, the specific mutation that may be causing the problems, and in particular help families with prognosis and the children that may have certain increased risks, especially for things like sudden cardiac death. Know how to restrict their physical activity if that's necessary, or do things that will prevent adverse outcomes, bad outcomes in the children.
When we went in and they actually, put me on prescription medicine, they had told us that I will still be able to continue dancing, and they want to actually see how I cooperate with taking the medicine while still being active.
I do one annual routine visit with my cardiologist, usually in September, and I basically get an EKG and echo, and they just see whether or not the thickening of my heart got any bigger.
For children that present and they're sick and they have congestive heart failure or other problems, frequently they will need medication and therapy, and so their course is different, and it really depends on how they respond to their therapy.
They decided that they wanted to do the myotomy myectomy, which is basically where they go in and they shave the walls or the passage of the heart to allow blood flow.
After the surgery, he was able to walk around, breathe better. He wasn't able to run and do all the activities his friends were able to, but he was much better than prior to having the surgery.
I had a defibrillator put in, I believe, 2 years ago, and the purpose of it is to shock my heart in the event that I have an arrhythmia.
People are like, what is that? I'm like, it's just a defibrillator. Like, what's that? I'm like, it's something to help my heart. And they're like, oh, okay.
Well, with the defibrillator, it kind of eliminates the fear, because the main fear without a defibrillator in my condition would be sudden death.
With the defibrillator working, it's actually a very good thing to have it fire, or we call it firing, which is really delivering a shock to the heart to change the rhythm from an abnormal rhythm to a normal rhythm, and it's very effective for that. The good thing about it is also a little computer. It saves the rhythms, so we can look back and see when it fired, what kind of rhythms there are, and so it helps us also think about what may happen in the future. If we are in a situation where medicines don't work, surgeries don't work, and pacemakers aren't going to help, that's when we get to the point where we say, this heart is really done, and we need to give the child a new heart, and that would be the ultimate treatment for cardiomyopathy.
Before transplant, I'd get sick a lot and I wouldn't be able to do much, so I always felt a little different than everyone else.
Pre-transplant, I thought he was active, but he wasn't, because now he's active. He's constantly going. You know, he could dance all day long.
Transplant, though it is for end stage, is not the worst thing in the world. It's really, again, I want to stress how much it's really the beginning of new life, and it's done so much for me that I feel as though I can do anything I want to.
It becomes so important for parents to really know all they can about their child's disease with cardiomyopathy.
When parents first find out about this diagnosis, often they think they're in it alone, but it's important for them to get out into the community and to do research and look online and find out there are other families who are going through it. Through internet searches, they can find web-based communities, support groups, all of those things where they can communicate with other families who have been through a lot of the same things.
One of the things that we do find is that there really is a relationship to the degree of understanding that a family has about the disease and how good or poor the quality of life in that family is.
Over time, parents tend to learn to not just live with it, but accept it, and to understand that they don't have to stand looking over their child every night when they put them to bed and just stare at them for the whole night, which is, of course, the temptation.
I didn't want to treat her like she couldn't go off away from my side, because I didn't want her to be so petrified of what she had as a kid. I didn't want her to be scared of just being herself. I wanted her to feel normal.
If you're open and honest, it doesn't mean you have to tell them every single medical term, but you really want to be as truthful as you can, because you want to keep the whole family together on this.
I tried to, tell him, everything's going to be okay, we're going to get it fixed, we're going to get your heart fixed, and he would talk about how, well, we're going to get my heart fixed, and so that's how I explained it to him.
When you're young and you're just going to the doctors, you don't understand that you have something. So children don't get it. It's the parents that are going to treat them like they have a problem.
I think the time of understanding and accepting the disease, as Chris does now, it took 17 years to get there.
To cope with the situation, I usually seek I just go to my cousin to talk, or I go to my mom to talk about it.
To keep positive when I'm really down, I usually listen to music. It usually helps a lot. Or if I exercise to let it all out, it usually helps a lot too. Or just simply go talk to my mom or my sister.
When you gotta be strong, you gotta be strong. And sometimes, even when you're supposed to be strong, you try to be strong.
Comes in.
It's just you're a parent.
But there's nothing wrong with that either. I think it's good. Let it out and, you know, get that feeling, you know.
Sometimes you just have to. It's just.
It makes me feel better when I cry.
I'm a firm believer that prayer has a lot to do with good outcomes.
My family is by far my greatest support. I think mainly my mom, because my mom has been there for me throughout this whole thing.
There's often a concern about how to talk about it with the siblings and what they're going to think about it, but it's really important not to keep this information private.
I sometimes wished it was me just because she's my younger sister. I, you know, can't even imagine having to see her go through so much pain.
We can bring the siblings in, and child life specialists can meet with them and explain what's going on and answer some of their questions, but utilize those resources to really help the whole family feel included.
I realize that I can't have everything whenever she needs something, you know? Because, I mean, that outweighed my need of a video game or something. Whenever she needed medicine or something, that outweighed it a lot.
I've always wanted to be a doctor, but as I watched Justin progress and watched his symptoms get worse and have seen personally what it's done to our family and the things we have to overcome, it's been very inspirational, and it's very easy to find inspiration in that.
We see many children that live with a diagnosis of cardiomyopathy, live through a therapy for cardiomyopathy, and live beyond cardiomyopathy and get on with their lives.
We have a routine, and that's what we stick to, and I guess that's what helps me.
I'm a little bad at taking, you know, medicine, so kind of getting used to the day-by-day routine of, you know, get up, take your medicine, go to sleep, take your medicine.
When we're trying to teach patients and children about their own diagnosis, you know, we first find out what's going on with them, what do they understand about what they have, and then when they're getting ready for discharge or getting ready to go home and sort of live with this disease for a while, we want to teach them about signs to expect and how to sort of take care of their own bodies.
If you want to do this and be healthy and have that heart in your chest for a long time, you've got to watch yourself. And she has always had a weight issue, that she's gotten her weight off in the past year and a half. But this last time she went in, you know, they told her, you need to watch your diet. They brought in a nutritionalist who talked to her, and you know, starving yourself isn't the way to go about it.
And that did put effect. That was one of the reasons why it, you know, kind of made the functioning of my heart a little worse. That and being vegetarian for a year. I was vegan for 4 months, so not enough protein's not good for having a heart condition.
I think in all health sense it's good to keep low sodium diets, so I try to cook all my meals for them with as little amount of salt as possible.
He eats lots of vegetables. He drinks lots and lots of milk. You know, I try to, you know, give him his medicine, you know, that's on time intervals. So I try to give him on time, you know, I don't miss any medicine. One thing I try to do is try to make it fun. He can take the pill now, and he gets really excited about that because everybody claps and thinks it's cool.
I'm very careful with being around germs and sick people, taking my medicine, taking my vitamins to make sure I'm well and I don't reject where I have to go back in the hospital.
When I go to the grocery store and he goes with me, I mean, I always have, like, you know, the antibacterial wipes to wipe the buggy off. You know, if he gets in it, you know, there's been lots of kids in there, and those germs just don't do well with him.
When you have an emergency situation that comes through, such as a hurricane, I need to have both of the girls' clinical summaries that tells what they have, when they were last seen, what medicines they're on, and then I had to actually make arrangements with the pharmacy to get some extra meds.
We usually bring up and discuss on a child-by-child basis how best to communicate this information to your child's school, to extracurricular activity leaders that your child might participate in.
My daily activities consisted of things that were very normal. Of course, there were precautions like washing hands,
I always made it a point to go by and stop by the nurse's office and get familiar with her and to let her know about Linda's condition.
You know how kids are, they will fight over a toy that, you know, he doesn't need to be, you know, pushed in the chest or anything like that.
I try to plan most of their weekend activities at our house. The reason for that is that I can manage it. So our house has become sort of the school's favorite place to hang out.
I think for patients such as Justin, who throughout his life had hypertrophic cardiomyopathy, we were very encouraging for him to participate in normal activities that he could do as a child, play recreational football, soccer, sports with his friends, ride his bicycle. I think it's difficult in the family. It was difficult for all families with hypertrophic cardiomyopathy who know that exercise may be a risk factor for bad events to happen, to let their children have an exercise regimen, but we do try to have a nice balance between the two.
You have to redirect the kids' activities. Don't take them away from running and playing and restricting them, but get them into other things. Get them into playing an instrument or becoming a manager instead of a player, or things of that nature where they don't have to do the burst activity sports that we so much like in the United States.
I was in 8th grade and I wanted to try out for cheerleading. She was going to let me until Dr. Tobin pulled the plug and was like, you can't do that.
I want her to try at least, and then if it doesn't work out, then we can come back and say no. But it's going to come from the medical point of view.
When Dr. Tobin told me no, I was really crushed. I remember I cried for like a whole night because it was something I really wanted to do. All my friends were doing it, and I just felt like, why couldn't I be normal? Why couldn't I be like them?
Because I wasn't able to do anything strenuous like running, I wasn't able to play soccer, basketball, so I took up golf. I started getting into photography. I started doing video editing, and in a way I'm grateful because I guess if I didn't have this heart condition, I would have never have gotten to where I am. Like, I wouldn't have been as interested in these things.
In 2nd grade, I had become really good at mathematics, and during my gym period, I remember once I went to a 7th grade math class, and that really sparked my interest in math, and that's something I've been following up with and pursuing ever since.
I have pretty good grades. I've maintained a 4.0 and higher for the past 2 years.
And you know what? She made a 4.0 even after being homeschooled in 9th grade. She got an award for that. I was really proud of her.
There are many things in life that don't involve becoming the highly competitive athlete, and I think we encourage our patients to pursue those kinds of interests and become excellent and outstanding in something that doesn't involve high levels of activity.
When you really have a cause of genetic metabolic cardiomyopathy in kids and you really have tailored therapy that goes beyond heart failure therapy, do you feel this really augments or has an added benefit to these children?
Absolutely, because we can anticipate problems before they happen and prevent them. So we can anticipate problems that might be like low blood sugar, that might be muscle weakness. If we need to start early intervention, for instance, we can do that to maximize children's neurological outcome. And so the whole package, making sure the children are well with their entire system, is the goal of our therapy.
Alternative forms of treatment are being developed. So one of the things that we need are mechanical devices to bridge kids to transplantation that would otherwise be hospitalized. Those are these so-called ventricular assist devices. And we believe that some of those devices, if implanted early enough, will actually reverse the disease for an extended time frame. So we see it as not just a bridge to transplantation, but a bridge to recovery in some people.
We still don't know why, with the same defect, some people have more or less hypertrophy, and I think that's an area that we're very interested in finding out answers to in the future.
Jalen will go to school next year. He'll be in kindergarten.
I'm a senior right now, and so I'm looking towards college. And after college, I plan to go to graduate school. I want to be a biomedical engineer. And so this field really helps to improve medicine through using knowledge in the natural sciences.
I personally want to be a director when I grow up. I find film very interesting, and it's something that I think I could be good at.
I really want to be a forensic scientist or a criminal justice lawyer.
My aspirations for life, or I guess what I want to be when I grow up, is a pediatric psychologist. I also want to study neurology and parapsychology.
I hope for families out there to realize, if they have kids that have the same thing that I had, that there is hope and everything will be okay, because even though my family and I have been through hard times, somehow we still made it through and everything's okay now.
Just stay close and stay strong and keep an open mind. You never know what's ahead of you, what obstacles you're going to have to face. It's just all a matter of staying close to the ones you love.
I feel like there is a cure, for cardiomyopathies. I think that they have quite a bit of more research to do, but I really think that, the doctors are put here, on this earth for a reason, and I think that's to find out things like that.
It's nothing to be scared about as long as you have the doctors behind you. And just basically stay positive.
Definitely be optimistic. There are so many opportunities available despite having the condition.
My hope is to cause a little bit of peace of mind for somebody, that if your child is dealing with this is not the end of the world. It's not the end of the world for your child, not the end of the world for you, your family, your future.
Hi, I'm Lisa Yu, founder of the Children's Cardiomyopathy Foundation. From personal experience, I know that living with a chronic disease can be overwhelming, but it is manageable, as these families have shown. If you haven't already done so, please take a moment to register with CCF to take full advantage of our services and resources. I hope that the stories and information that you heard here today will make your path to understanding and acceptance a little easier. Together, we can uncover the secrets of the heart.